Nurses and midwives make up more than half the healthcare workforce worldwide. By virtue of providing health services, their role is undoubtedly very crucial. They are people who devote their lives to caring for huge populations in their respective communities and countries at large by providing proficient healthcare services. Looking after mothers and children by, among other things, giving life-saving immunizations and health advice, and generally meeting everyday essential health needs for the people are some of the vital services they provide. They are often the first point of care in primary healthcare provision. The world needs 9 million more nurses and midwives if it is to achieve universal health coverage by 2030. Hence, to advance the important role of nurses in transforming health care around the world, the World Health Organization at the World Health Assembly in Geneva in May last year endorsed the year 2020 as the International Year of the Nurse and Midwife, following the designation by the Board of Executives in January 2019. This was also to honor the 200th anniversary of the founder of modern nursing, Florence Nightingale's birth. Nightingale was a visionary nurse and leader, and the nursing fraternity are thrilled to honor her. The 2020 International Year of the Nurse and the Midwife celebration is expected to elevate nursing throughout the world and lead individuals to recognize the many contributions of nurses in global health care. Being aware of the important role nurses and midwives continue to play in the implementation of primary health care to the people of Zambia, the Zambian government assented to the dedication of the year 2020 to the two professions.
Zambia is a member of the World Health Organization, and one of the key decisions the World Health Organization through the World Health Assembly made was to amplify the importance and the role our nurses and midwives continue playing in improving the health and well-being of our people. To that effect, the WHO indeed did declare 2020 as the year of a nurse and a midwife. And for Zambia, this is gratifying because when you look at the health sector in this country, the majority of the health workers are nurses and midwives. This is a practice which is very expansive. When you are admitted to a health facility, you are with a nurse 24/7. Other cadres may come, look after you, but at the end of the day, the gatekeepers remain the nurses and midwives. For us as a country, when you look at the continuum of care, we talk of promotive, preventive, curative, rehabilitative, and palliative health care services. Again, you see that our nurses and midwives, their role and responsibility and practice spans across the continuum of care. There are very few professionals whose service or practice spans across the whole continuum of care. Many a time, when you hear of good services in a particular facility or in a country or in a region, it means nurses are working. Therefore, Zambia fully supports the importance of recognizing our nurses and midwives. And that's why we've embraced Nurses Now campaign. And what this means is that we need to appreciate and recognize the role our nurses and midwives play. Indeed, we fully support WHO 2018 to 2020 and also galvanized by the International Council of Nurses with various governments. We agreed that let's put prominence on appreciating this cadre who has been there since time immemorial to ensure that our people's lives are improved. So to government, ourselves as leaders, our role is to always put nurses where they belong and give them all the support and encouragement. You are aware that the Ministry of Health has always appreciated nurses in terms of giving them space and ensuring that their environment of care is always improved. This is work in progress and we'll continue building on that. I take this opportunity to appeal to the nurses to be proud, enjoy their vocation. Yours, nurses and midwives, is not an ordinary responsibility. It's a unique one where everyone expects so much from you. You should not expect to be thanked or appreciated. For you, it's to work, eyes on the ball, be focused, and the public will be on your side.
The Year of the Nurse also coincides with the Nursing Now campaign, a 3-year global campaign of 2018 to 2020 aimed at empowering nurses and midwives to take their place at the heart of tackling 21st century health challenges. At global level, the World Health Organization wants to collaborate on the Nursing Now campaign to support nurses and midwives around the world to contribute towards achieving universal health coverage.
Ministry of Health fully supports our nurses and midwives, and as we recognize them, as we appreciate them, in the 2020, the Year of a Nurse and Midwife, and also celebrating the Nursing Now campaign, we remain indebted to your contribution, and we assure you of unfaltering support as you execute your noble cause. Viva nurses, viva midwives. Indeed, you deserve the appreciation and the accolades. You are the heroes and the heroines, not only for COVID response, but also for routine health services. You've been there. We are proud of you.
In Zambia, the nurses are elated to be recognized for their noble contribution towards the attainment of health for all.
The reason why 2020 was pronounced as the Year of the Nurse was again to highlight the important position that a nurse and a midwife holds in care provision, and that if we have to achieve universal health coverage, we have to ensure that in all decisions that we are making, we involve a nurse and a midwife, because we are critical to achieving universal health coverage.
Dr. Mwape further highlights the importance of the Nursing Now campaign to the profession.
This campaign to Zambia means that we are being called to action to make sure that we highlight the important position that a nurse and midwife holds within the healthcare provision. We need to ensure that nurses and midwives have access to capacity building opportunities so that they improve their competencies. And we also know that health challenges are not constant. They are variable, so they change all the time. And from the fact that the health trends change, it's important then that we empower nurses with competences on an ongoing basis so that they are abreast with the changing health trends.
Dr. Patricia Mkwato, Dean at the University of Zambia School of Nursing, and Dr. Catherine Ngoma, a senior lecturer in the Department of Midwifery, Women and Child Health at the same learning institution, share their sentiments concerning the designation of 2020 as the International Year of the Nurse and Midwives.
For me, the declaration is a recognition that nurses are very important. Now we are talking about universal health coverage. You can never have universal or attain universal health coverage without the nurse. And for us as the nurses, it's time actually to reflect. If other people can recognize that nurses are very important to ensure universal health coverage, to reach to those populations that are in the far-flung areas, then as nurses we have to take it upon ourselves to say that this recognition is very key, and maybe this is the point at which we can change as nurses. If people are able to recognize our role, then let's do something that will have an impact to save the population.
Oh, as a nurse, it means quite a lot. We need to do quite a lot in terms of marketing our career as nurses and midwives, so that more people out there are able to see what we are doing as nurses and midwives in the country, and also our colleagues outside the country.
Like other professions, nurses and midwives equally have their own experiences in their line of duty. Registered midwife Sharon Mushimbalume is acting sister in charge at the University Teaching Hospital UTH Women and Newborn Hospital Labor Ward, with many experiences to share.
It gives us so much pleasure to know that the health governing body has recognized us as nurses, and when you look at the programs that are under the year 2020 for the nurse and midwife, it's about championing the services of a nurse. It's about alerting people to realize the important role that nurses play. So we are important, and we feel delighted that we are being honored, even as we are celebrating the 200th anniversary of Florence Nightingale, our leader in nursing.
Equally, Victoria Lufuino, UTH Children's Hospital Pediatric Intensive Care Unit registered critical care nurse, highlights part of her work experience as she also shares her views on the designation of the year 2020 as a year of the nurse and midwives.
I have worked in a lot of departments. That was before UTH was separated into 5 hospitals, being surgery, medical departments, ECG and echo lab, and finally here in the intensive care unit. The year of the nurse means a lot to me because I know WHO has recognized the nurses and midwives. So to me as a nurse, it means I have to position myself in a way that I'm part of this great transition.
Having worked for the Ministry of Health as a nurse in the past 22 years, John Mukuka, a registered nurse and acting in charge at Matero Main Clinic, also shares his experience and what motivated him to take up nursing as a profession.
I worked at Mwanza Mission Hospital as a cleaner. After having worked as a cleaner there, I got interested the way, more especially the most person who inspired me was Dr. Brian, and she's the one who sponsored me up to where I am now. May her soul rest in peace. That's how I got interested. She asked me if at all I could do something in relation with medicine. I opted for this because I was a cleaner in theater. I've seen patients getting healed, and to me that is a plus in the sense that I joined nursing to save life. When I see patients going back on their feet, that inspires me to say, we as nurses, we are doing a lot for our clients. There was a case in Kanyama when I was working at Kanyama first level, that by then it was a health center. The patient was in her last labor, of which she wanted to deliver by the gate. But when I was called upon, I went to help up the patient until she delivered. And what inspires more, that child has taken my name. She was given a name to say Mukuka. Even when I go in the community, they call that child Mukuka. You know the person you have delivered at the gate, by the gate.
Meaningful recognition of nurses and midwives, like it has been in the year 2020, has the ability to renew their commitment to their profession, bestow added pride in their work, and deepen their loyalty. It also fosters an environment of positivity and team building.